Welcome to another Journal Club session. I hope you enjoyed last month's topic that looked at antimicrobial stewardship. If you missed it, don't worry. You can always access it through the YouTube channel. Are you watching this alone, or have you gathered a group of colleagues to watch it with you? If you are alone today, maybe consider watching with colleagues next time. You can access a guide how to organize colleagues watching together in the description section below. This month's article is titled "The Cry to be Involved: Experiences of Caregivers on Participation in Decision-Making and Care Provision at Mercy James PICU in Blantyre, Malawi." It was written by Chasweka et al. And published in the journal Comprehensive Child and Adolescent Nursing in 2023. Let's first look at the graphic summary of the article. This graphic breaks down the different sections of the article and provides a visual summary. In this video, we will now unpack each section. If you have a copy of the article with you, you could track the sections of the article as I speak. We start with the introduction that you can find on the first page of the article, just below the abstract. A child's admission to ICU is a stressful experience for the entire family. This can be alleviated by the presence of parents or family. Literature has shown that parents want to be present with their child and want to be involved in the child's care. Family-centered care is a model that was developed in the 1800s. It's known to decrease parent anxiety, a child's length of stay, and tension between caregivers and healthcare workers. The Institute for Patient and Family-Centered Care defined family-centered care as an approach to the planning, delivery, and evaluation of health care that is grounded in mutually beneficial partnerships among patients, families, and healthcare professionals. The family-centered care model has been introduced and adopted in healthcare policies involving children globally. There has been less implementation in Africa. Mercy James PICU is the first in Malawi to adopt the family-centered care model. Parents are allowed to be with their child throughout hospitalization. However, family-centered care should also allow family to be involved in decision-making and care, and this has not yet been explored in the context of Malawi. Therefore, the aim of the research was to explore the experiences of parent involvement in PICU at Mercy James Center for Pediatric Surgery and Intensive Care in Malawi. We now move on to the methods section of the article, where the authors explain how they gathered their data. You can find this on the third page of the article, right after the background. The study followed a qualitative descriptive design. This design was appropriate to the study aim as it allowed for the collection of rich data to understand the phenomenon that the authors wished to explore. Data were collected through semi-structured interviews. The questions were derived from the study objectives and were reviewed by clinicians familiar with family-centered care. It was pre-tested in the PICU and revised accordingly. Page 4, paragraph 1 of the article provides details of the questions asked. Interviews were conducted in a private room in the local language Chichewa. Participants were purposefully selected by the nursing manager and included the primary caregivers who were older than 18 years, of children who had been admitted to PICU for longer than 72 hours and who had been discharged from PICU alive. The authors aimed to interview 15 caregivers but stopped after 10 as saturation of data had been achieved. You might be asking what purpose of sampling is. It's when participants are selected because they have the characteristics that are of interest in the study. Data saturation is when enough data has been collected to draw the necessary conclusions and no new data is collected. Moving on to the analysis and results, which can be found on the fourth page of the article. The interviews were transcribed word for word, otherwise known as verbatim. The authors read and reread the transcripts several times to familiarize themselves with the data. Meaningful units were extracted and condensed into codes. The researchers then decided on generalizations. 10 caregivers were interviewed, of which 8 were female and 2 male, between the ages of 19 and 60. Their children ranged in ages from 7 to 50 days, and their length of stay in PICU ranged from 3 to 50 days. The results of the interviews are presented on pages 5 to 8 of the article, with main themes, sub-themes, and exact extracts from the interview transcripts to support the findings. Two main themes emerged: caregivers' participation in decision-making and caregivers' involvement in the child's care. Let's first look at caregivers' participation in decision-making. Caregivers had mixed reports of their participation in decision-making. Some felt that they were involved, and others felt they were not. Some caregivers wanted to be involved in decision-making and others didn't. Caregivers reported to be merely spectators during ward rounds, which was often attributed to a language barrier. In terms of caregivers' involvement in the child's care, caregivers participated in their child's care activities, for example, feeding, which might have included expressing breast milk, bathing or turning their child, providing love, comfort, and emotional support. The caregivers appreciated the support they received from healthcare providers to assist with care activities. They mentioned nurses most frequently. Which brings us to the conclusion. The authors conclude that caregivers are not adequately involved in the decision-making regarding their child's care. Caregivers were, however, involved in the care of their children, and this was gratifying to them. There are gaps in how healthcare workers are involving caregivers at Mercy James, and family-centered care principles are not adequately adhered to. The authors reported some study limitations, such as the results of the study could be strengthened and more information would be collected if the caregivers are observed during their stay with a child in PICU. Data collected through observation could enrich the data collected through interviews in the study. Relevance to practice included that findings could assist healthcare workers to develop guidelines and interventions to effectively involve caregivers in care and decision-making going forward. We've come to the end of the video, and so now you need to access the article. The link is in the description box below, or maybe you already have a printed copy. We really encourage you to read the article in full, recognizing the parts that we have just summarized for you. After you've done that, consider the reflective questions here on this slide. If you are watching with colleagues, discuss your answers between you. Following that, take a moment to think about what you have learned and how you could apply it to improve nursing practice in your setting.